This is Dr. Stone-Gale, and this is going to be just a very short discussion on blepharitis because this is a common condition that you'll see in primary care. Blepharitis involves the eyelid margins where the eyelashes grow and the openings of the tiny oil glands are located. There may be involvement of the skin adjacent to the outer edges of the eyelid margins and/or the inner edge of the eyelid that comes into contact with the eyeball. This usually results from some type of inflammatory process, whether it's infectious or non-infectious. And so that means that you could see a seborrheic type or an ulcerative type. The seborrheic type is usually related to some type of an irritant, so it could be from smoke or eye makeup, and the ulcerative would maybe be related to Staphylococcus aureus or even Streptococcus. So that is usually the underlying cause of that. With both of them, you're going to see inflammation involving the structures of the eyelid margin. But with ulcerative, you'll see more of an itching and a tearing appearance as well as light sensitivity. And the seborrheic will be more of a chronic inflammatory process of the lid with erythema, and you'll see some scaling of the anterior eyelid with some eyelash losses. You may see eyelash losses also with the ulcerative. So this is a chronic condition, and patients will come in with acute flare-ups of these. They come and they go. And you'll see it more in patients also with acne rosacea and fair-skinned people. Most cases of blepharitis are posterior blepharitis, which involves the inner eyelid. And it's usually due to inflammation of the meibomian gland of the eyelid. There are about 40 of these glands in each of the upper and lower eyelids. The opening of each gland lies behind the eyelashes. So the eyelid margins can become inflamed and irritated and very itchy when these glands produce some abnormal secretions. So blepharitis is usually, as I said, more common with acne because of that oil on the glands of the face. With the posterior blepharitis, you might also see someone who has allergies get this. With the anterior blepharitis, it involves the outside front of the eyelid. So it's the eyelid margins around the eyelashes, and you'll see that with someone who may have psoriasis or with some type of bacterial infection. So who is at risk for getting this? Well, if individuals that are constantly spraying hairspray, maybe hairdressers, or always have to have makeup on their face because they work in that type of profession, or even makeup artists, anybody who is sensitive to those type of irritants is more of at risk of getting blepharitis. The contact allergies, someone with diabetes, even poor hygiene. That's why it's really important to explain to them that they really need to have very good hygiene, eye hygiene specifically. And someone who has dry skin, the common skin microflora that you'll see with this is staph epidermis and as I said, the acne. In looking at the signs and symptoms of blepharitis, there's a couple different things, seborrheic versus ulcerative. And so when we look at somebody who has seborrheic blepharitis, we're looking at someone who presents with a chronic inflammation of the eyelid. They're going to tell you that they may put makeup on, or they may put cream on their eyes or something, and it exacerbates it, but they always seem to have a swelling of the eyelid. That's a chronic thing. And they could also have erythema, as well as like a gray scaling of the anterior eyelid. You may see that they have started to lose some eyelashes, and it's very common to see someone who has very thinning eyelashes. And if they do on exam, when you're doing an eye exam just for any reason during a physical or anything, you may want to ask them if they're having any problems with their crusting on the lashes or in the corner of their eyes or on their lids, because that would give you an indication if they do have a blepharitis pattern going on. They may also have dermatitis in their scalp, and they may have it on their eyebrows as well. So those are some of the things that you need to ask them. If they have an ulcerative pattern going on, then the area is going to be a little bit warm. You may also see the absence of eyelashes or some broken eyelashes. They'll complain of having burning and tearing in their eyes as well as light sensitivity, and they may have some small ulcerations that you may see on their eyelid, at the margins of their eyelid. With both of these, they may wake up in the morning, they may have crusting, their eyelids may stick together, they may have a lot of watery mucus discharge and blurry vision and eye redness. And this is a really good, three really good pictures of what blepharitis looks like. You can see that appearance of the crusting around the eyelashes, and you can also see the lids, how they're swollen on the top right picture, the bottom lids very swollen. And you can also see how the upper lashes are missing. There's a significant amount of lashes missing, and this is because of the blepharitis. So as you're thinking about getting a history on these patients, it's very important that you ask them a couple questions about onset and duration. So your history of present illness should be, how long have you had this? When did it start? Have you had it before? What kind of eye discomfort are you having? Are you having light sensitivity? Are you tearing? Are you having any eye discomfort at all? Do you have any styes that have been occurring in your eyes? Do you have swelling, loss of eyelashes? All of these are really important to get in the history of present illness. But as you think about their ocular history, this would go in your review of systems, where your ocular history is asking them if they wear contacts? Have they had any previous eye issues? Have they had blepharitis in the past, a history of conjunctivitis? Do they have any type of eye surgery that they've had at any time in their lifetime? And do they have previous and present skin problems? So do they have a history of acne? Have they had any problems with staph epidermis on the skin? Have they had any problems with facial seborrhea? These are really important. And do they have any type of chronic exposure to the irritants? So think about what you need to ask in your history of present illness, as well as what you need to ask in your review of systems of the eye. And the review of systems is looking at what they have had previously in regards to the eye. When you're getting to the physical examination, your priority is to assess their visual acuity and make sure that their vision is documented. That's something that's very important. You always want to perform a complete eye exam and document that exam. So you need to be looking at their eyelid margins, looking at the structural lid changes. Do they have inward and outward turning of the eyelids? Do they have redness of the sclera? Is it injected? Is the conjunctiva injected? Do they have any lesions on the lid margins? Do they have any palpated tumors or palpated masses that you might feel on those lid margins? And then look at their skin and their face and their scalp. Do they have dandruff in their scalp? Because when dandruff is present in the scalp, then you need to do a dandruff shampoo for the scalp also, because this could be causing some of the problems with the eyes. In addition to that, make sure that you are looking for any type of acne that they may have on their face, or any type of skin irritation that they might have. So this should be a very thorough, detailed eye exam. As we talk to the patient about treatment for blepharitis, we want to explain to them that these really are self-care guidelines that they should follow. So applying frequent warm, moist compresses does help significantly to decrease inflammation. Cleaning the eyelids with a diluted 1 to 10 solution of baby shampoo works very well. And doing this 2 to 4 times a day with washing the lids is usually recommended by the ophthalmologist as first-line treatment. Also, practicing good hygiene of the face and scalp. It's important to let the patient know that they should not go to bed at night with mascara on, with eyeliner on, with eyeshadow on, because it's very irritating throughout the night. There are some other treatment options that we can look at when treating blepharitis. If the patient is having symptoms after they've tried the eyelid hygiene and they're not really responding well to that, then you may want to consider topical antibiotic ointment. And this is really at your discretion. If you think that the patient is truly following, doing 2 to 3 times, 4 times a day. They're doing really good hygiene. They're not wearing their makeup to bed at night, and you believe that they're following all of these recommendations, then you may want to consider giving them some bacitracin or erythromycin ointment and have them apply it either 1 or more times a day just for a few weeks. Also, systemic antibiotics might be an option if you think that they're not really responding at all to the topical and you suspect that there's a secondary infection. Severe cases of blepharitis usually require some type of long-term use of antibiotics such as tetracycline, and at this point I would consider possibly referring them to ophthalmology for treatment. For topical corticosteroids for inflammation, you can use that, but I would really reserve that as last resort. And then think about what some of the differential diagnoses could be for this. Could they maybe have a chalazion? Could they maybe have a hordeolum? Could they have basal cell, squamous cell, sebaceous cell, cancer? So these are things that are really important, and if you suspect anything suspicious, that you need to go back and you need to think about referring them to ophthalmology or even a dermatologist to have them look at this. So if you don't see improvement after treatment, that's another thing, is you need to make sure that you do refer to an ophthalmologist, because they can get complications of corneal infections. They could get scarring of the eyelids. They also can get something called trichiasis, which means that the eyelids go in a misdirection. So the eyelids could go inward towards the eyeball, and that's something that you want to look at. So think about all the differentials that you can come up with before you actually make a definitive diagnosis of blepharitis.